On Friday, several delegates were given a tour of the new critical care block at the Princess Margaret Hospital, including the intensive care unit, laboratory, central sterilization area, recovery theater, and the neonatal ward. PMH's Chief Medical Officer, Dr. Glenn Benaby, welcomed the Commonwealth's Head of Health and Education Advisory Committee, Dr. Joanna Nurse, a featured speaker at the conference.
It gives me particular pleasure to accompany her on this tour to our critical care block. You know, we are very pleased and proud of this block as the leading critical care block within the Caribbean region.
As part of this event, before it starts next week, I've kindly been invited by the Ministry of Health here in the Bahamas to look at how the two sectors link, how they contribute and how they benefit to each other's agendas. So how health benefits education and how education benefits health, as well as framing how that influences and supports the delivery of the new universal health coverage policy.
For the Bahamas to be leader in healthcare, Dr. Jerry Eichmann says everyone should be able to afford to see a doctor when they are ill. She says the Bahamas is about to take this step with the implementation of national health insurance in January 2016. The Pan American Health Organization representative for the Bahamas and the Turks and Caicos Islands underscored the importance of universal healthcare at a panel discussion on universal health coverage on Friday.
There will be no money in between the person that needs the doctor and the doctor. There will be no obstacle that's financial. That needs to be eliminated. The second thing that needs to happen is to strengthen the preventative care, like screening for cancer and heart disease, etc., into every healthcare plan and make it available to everybody who normally would not get it. And if you need to go beyond your health centers, if you need to go to your malls or to your events to do the testing, let's do it.
She says people must also stop seeing health as something that begins in the doctor's office, but realize it is created in the home and various communities. Eichmann says more focused attention must be placed on prevention and maintaining good health instead of seeking a cure. While noting the linkages between health and education, she shared a recent PAHO Global School Health Survey, which highlighted that nearly 45% of adolescents between 13 and 15 are overweight and more than 20% are obese.
The more we see the problem of health this way, the more opportunities we have to improve health. And scientists have found, and every day there's more evidence, that the conditions in which we live and work have an enormous impact on our health long before we see a doctor. There's some best practices globally. For example, schoolyard, backyard gardening initiatives, to get kids familiar again with vegetables, fruits, and how to prepare them, etc., and produce their own food for healthy lunches. Very important is an enforced policy around sugar consumption.